My brief is to tell you a wee bit about why we are doing this conference, and I'm going to begin quite wide. So we had World Mental Health Day last week, and there was a lot, well, comparatively, there was a lot of media coverage. The Guardian, about a week ago, reported on Nick Clegg's announcement of an additional 120 million into mental health over the next 2 years in an attempt to achieve parity of esteem. We know about that term. It was something that people, when I was in London talking to service users and carers, wondered what kind of a term was that. But it relates to some sort of the relation to really deal with the gap between mental health services and physical health services. So that's what the 120 million is aimed at, and how they're going to target it really is in relation to care waiting times standards. You're familiar with this one. Waiting times is big with governments. I'm more concerned with quality, really, but so 2 days after this announcement, in the Guardian letters page, there was a kind of an interesting response, and they entitled the letters "What Nick Clegg Didn't Say About Mental Health." Just to give you a quick idea of some of the themes that were coming up. People talked about his failure to realise the connection between the coalition's policy of economic austerity and the increased rate of mental health. In other words, he was putting in money, but at another level, their policies were actually causing an increase in mental health that they were hoping to try and deal with this new input of money. Just the sort of contradiction there. There was a concern about the introduction of a sort of medical diagnose then cure model of short-term therapies in the National Health Service. That's referring to the new psychological therapies, which can be very short-term. There was a fear about scantily trained practitioners and inadequate opportunities for clinical supervision and for reflective practice. So these were just some things that people were writing in and saying, okay, they're going to spend that money, but look at what Nick Clegg hasn't talked about. So thinking about our conference, I was thinking that a lot of people in this room could think about something else that Nick Clegg didn't talk about. And that's basically the role of families in mental health. Now you might just think, oh, I'm going on again at a tangent. But what I'm suggesting really is that if some of that money, and I've read, thanks to somebody who sent it to me here in this room, Laura, I've read the document that accompanies this investment of money, Norman Lamb's document recently out, and there's no reference to families, to services for carers, none whatsoever. And what I'm suggesting is that if some of that money was invested in working with families, that would affect waiting lists. That's a way of cutting the waiting lists, but it's not the kind of thing that comes easily to the minds of the kind of people who are making these decisions, politicians and healthcare managers. So just to make that point, it seems to me that our culture has a tendency, certainly the dominant culture, has a tendency to individualize and to sort of fragmentalize things, not to see things in a holistic way. And in the case of mental health, what we have is a kind of mirroring of the medical practice of dealing with the individual. So it seems to me now that even we as carers have become so inured, so customised to seeing these kinds of documents and policies coming out with absolutely no reference to families and carers, that we don't even see it anymore. And so, to me, that's one of the reasons we're here, is to raise awareness of the importance of families and carers in mental health. I'll elaborate that a wee bit more. But certainly, these documents don't acknowledge that we are part of the solution. So that's the point I would like to make about the Nick Clegg story. I think that our guest speaker, Elizabeth Kuiper's presentation, will, I'm sure, tell us quite a lot about the evidence base to make the case that I'm talking about here, the importance of families in supporting recovery. Okay, so another document came out recently, and that was the National Schizophrenia Audit. And I'm not getting this to work. There we go. We've pulled out just one, but let me read the 4 areas of concern that were identified in, this is the Royal College of Psychiatrists' National Audit of Schizophrenia. So the report calls attention to the following 4 areas of concern: poor monitoring of the physical health of people with schizophrenia, and a lack of action when warning signs are identified. Secondly, people who are not responding to standard antipsychotic medications are waiting too long to be prescribed clozapine, which is costly. The next 2, CBT and family interventions are not widely available. And the last one, there is not enough information and support for carers. Now, we've pulled out one, which is the inadequate provision of information and support for carers. But we should really have pulled out, and I meant to change that slide, the one before, which is family interventions are not widely available. Okay, so that's the audit of schizophrenia is putting out 4 areas of concern, and a half of them, 2 out of the 4, are about carers and the inadequate services for carers. Okay, so the reasons for this conference then, apart from the pleasure of us all getting together and having nice cons and everything else, is to raise awareness among carers, ourselves, and among service providers, and especially among service commissioners, about what mental health caring is really like. I have wrestled with this one because, we're part of carers, we're part of the carers movement. We all totally appreciate the enormous amount of work that carers, in relation to every illness, put in. But there's something very specific, I think, about mental health caring, and I hope that we might be able to address some of that in this conference, and I'm hoping that Patrick's talk might, I'm very pleased to welcome Patrick Coburn, who has, along with his son Henry, written a book about the intimate experience of being a carer and being a person with a diagnosis of schizophrenia. So that's one thing I'd like us to do, think about what mental health caring is really like, about its importance in relation to recovery for those we care for and care about, and about some effective and evidence-based ways in which the needs of carers, and by implication their loved ones, can be met in relation to service delivery. So they're the kinds of things I hope and I know that our speakers will be addressing for us today. So not to be too negative, having said that, I want to draw attention to some of the, well, first of all, I'm going to get a drink. Some of the positive aspects in Northern Ireland for carers. Is this working again? Huh? Okay. So, what can we say positively for carers in Northern Ireland? Well, I think we can say cause. Cause is a sort of commissioned voluntary service, carer support, education, advocacy service. And it's the like of which I haven't actually seen anywhere else in Britain. So I think that's something for us to celebrate. There's also in our health service evidence of increasing willingness to involve carers along with service users in the development and co-production of new strategies and services developing now, not least in the implementation of recovery through organisational change. That's IMROC. There's a lot of service user and carer involvement, and it's nice to see the acknowledgement of service user and carer involvements in the documents that are produced around those new services. I've given the example of the recent launch of the new mental health care pathway, and at the same time we had the launch of the new personality disorder care pathway, both of which were seriously co-produced. That is, involving service users and carers and providers in the development of those, and also the mental health and psychological therapies threshold guide, which also had significant service user and carer input. Okay, so then thirdly, we've used the term triangle of care, and maybe some of you are familiar with that and some of you are not. We've used it in naming our conference. It's a specific model, and Lou is going to talk to us. Lou was one of the people who developed this model. Wonderful. She's going to talk about that in more detail. But basically, it's a model to ensure the early identification and engagement of carers. And this is a prerequisite, obviously, for the needs to be identified of service users, of carers, but also for us to be able to do the work of supporting the recovery of our loved ones. So that early identification of carers and beginning to work with them at the earliest possible stage. So that's the idea behind the triangle of care, and Lou will talk about it. But just to say that here in Northern Ireland, I'm delighted to say, and Margaret Wood's here in the audience somewhere, I saw her, that the Belfast Trust is beginning to try and roll out the triangle of care. And Angela and Marty Daly and Maura, is Maura here? Some of our care advocates and some of our service users are closely involved in that work. So that's a very positive development. It was one of the asks in our CAUS launched the Carers Manifesto last year, and it was one of our big asks. So it's nice to think that that might be beginning to happen. Right, so concerning our manifesto, in our manifesto, we asked that carers be acknowledged and supported in the following roles: as partners in care, as supporters in recovery, and as advocates for change. Associated with these roles, we express the need for lots of relevant supports and services, but essentially we are asking for the acknowledgement of and support for collaborative working with families and with friends who are carers. So we want a triangle of care, we want collaborative working between service users, carers, service providers. So just very quickly, because we have addressed this 4 years ago, and Lou was here for this conference 4 years ago. We had another conference, we had a conference on carers and recovery. We brought over people from England, a service user, and another practitioner who did workshops on recovery. And we did a conference both in Belfast and we did one in Omagh. And let me tell you, the focus was recovery for carers, right? You may have come across the concept of carer's journey. So basically the idea that the journey that a carer goes through from the traumatic initial stage, which can last a long time, it lasted about 4 years for me, no longer. In fact, I probably carry some of the trauma still in my body after 17 years. But from the traumatic early stages, through a process of all sorts of emotion, coming to maybe, if you're lucky, a point of acceptance. And then the interesting last point in the carer's journey in the literature is a move into advocacy. Carers, some carers, all carers in a sense, move into advocacy for their loved ones, and some carers move into advocacy more generally to try and deal with changing the services. So the argument was that that carer's journey is a journey of recovery, and that process of recovery has a direct impact on the recovery of your loved one. So they're completely interrelated. To try and do recovery without its concomitant, without its complement of working with families, is to work with one hand tied behind your back. And we now have MROC. And MROC actually, I came across this at a conference in London a few months ago. MROC actually does have a document on carers, which I think I have to make more available here because it doesn't seem to be in the public domain. But the point I'm making is that things like the triangle of care are part of completing the circle of recovery. Recovery for everybody. And when I say recovery for everybody, I don't actually just mean for service users and for carers, because it's quite clear, and the process in MROC, for those of you who know about it, and if you don't, forget the term, but it's quite clear that, that our professionals, our practitioners, need to recover. They have been delivering a not very good service. They have been working in conditions that haven't been conducive to them being able to do what they were trained to do and to express the caring that they want to give. So they need a recovery process, as does the system itself. Okay, so basically, that's all I'm going to say. I'm going to hand over to Mark now. Thank you.